Well, I'm here at ASCO to present a double-blind randomised study which investigated a natural plant-based balm to try and act as a local antidote to severe nail toxicity during chemotherapy. There's a number of drugs do this, but the one most likely is called Taxotere, which is one of the most commonly used chemotherapy drugs at the moment. It's used for breast, prostate and lung cancer. And about 50% of patients get quite severe and distressing nail damage, where the nails can even come off in extreme cases and you can get secondary infections.
Okay. And at what point does the balm start to help that out, and what are the benefits that you've seen?
The background to the study is we set up a scientific committee to try and find therapies which would reduce this damage, there's various things already available like cooling the nail beds, but they're not particularly practical. So what we did amongst our herbalists and plant scientists is try to work out why you get nail damage. So it's a combination of damaging the proliferating cells, you get over inflammation, so excess inflammation locally, and you get secondary infections. So we developed over about 2 or 3 years a balm with various natural essential oils, etc., which have anti-inflammatory, antioxidant properties, and then got a UK company to develop it for us and set up a randomised trial with 60 patients, 30 in each arm, 30 on placebo, 30 with the intervention. And they used it from the start of chemotherapy until the end. And we were quite, very pleased to see when we opened up the blinding that virtually no patient in the active group got any nail damage at all. The hypothesis was it would get absorbed into the nail beds, reduce the toxicity from Taxotere, stop it getting, damaging the fast-growing cells, and prevent over-inflammation and secondary infection, and it turned out to be completely correct.
A significant boon for quality of life then?
Definitely, because one of the endpoints of the trial was measuring patient nail-related quality of life. In fact, that's the one we felt was most important because it's what patients experience, and that was very highly significant. In fact, in the Polybalm group, we call it the Polybalm group, they actually reported an improvement in nail-related quality of life by the end of chemotherapy, on average. Yes, that's one distressing side effect patients now no longer need to worry about. They're still going to get everything else related to chemo, but that's one we're very happy to feel we've contributed in that arena.
Yes, well, the hair cooling systems tend to be the one that everyone focuses on, with hair loss being immediately visible, but I can imagine the sensation of nail deterioration being equally concerning to patients. So it's good that they have this.